Hi everyone, hope you're having a great day. Today I'm talking about ovulation and everything that has to do with hormones and ovulating with PCOS. So this is a common issue when we see women with PCOS having irregular cycles because their ovulation is off. It's not on this perfect, 14-day or cycle day 14. So when I say cycle day 14, cycle day 1 is the first day of your period. And usually on a textbook, cycle, you would be ovulating around cycle day 14, and then 14 days after that, you would get a period. So I want to kind of bring it back and kind of explain what's going on in the body to give you some context as to what ovulation is and how it's happening and where in our body the hormones are being produced and where the signals are coming from the brain. So let's talk a little bit about estrogen and its ability to help build the follicle. So what happens is when you get your period, your estrogen starts to slowly rise at this point. As the estrogen rises, this allows for the follicle in your ovaries to be built. So what happens is on cycle day 1, you get your period, you're going to actually bring a few follicles on each side of the ovary. So typically they say 10 on each side is textbook. So what we often see in PCOS is that the patient is bringing way more than 10 follicles on each side. It could be like 12 plus, sometimes 20 plus. And that's why our AMH or anti-Mullerian hormone is high, because we have more follicles there. What happens is as those follicles mature, because you're making that estrogen, one of those follicles, so out of the 20, so 10 on each side, let's say, out of the 10 on each side, one of those follicles is actually going to become big enough to allow for ovulation to happen. So what is a follicle? Follicle is basically in our body, we house many follicles, and they're all, some are dormant and some are at their stage of final maturation, and one will actually ovulate out every month. And when I say one will actually ovulate out, it actually means that the follicle houses the egg, and that egg is going to come out of the follicle, and that's what ovulation is, which I'm sure a lot of you know, but just to kind of explain what's going on there in terms of the follicle and follicular development. So we need estrogen to rise to its peak. This is when LH, luteinizing hormone, it comes from the pituitary gland in our brain. It's going to allow for that egg to come out of the follicle and make its way down the fallopian tube, where hopefully if you're trying to conceive, will meet sperm, and if you're not, it won't meet anything, and we'll end up getting a period. And so what happens is in PCOS, sometimes there's too much testosterone there, and it prevents estrogen from rising nicely to get this nice ovulation going at the appropriate time. Sometimes the body tries to ovulate a follicle, and then it's unsuccessful, and then it's going to try again. So that's where we kind of see our LH surging at multiple times in the cycle. Or we see LH is high, so this luteinizing hormone only should happen around ovulation, have this spike. LH in PCOS women can be high all the time, so that's also preventing us from ovulating at a specific time in the cycle. If you have really long cycles, like for example 40 plus days or even 35 plus days, sometimes a lot of my patients say that they have their periods when they come to see me for the first time every 2 to 3 months. So what's happening there is the follicle is taking a very long time to get to its size, and typically it's because there's too much testosterone and not enough estrogen there. So now that you know what's happening in the first half of the cycle, so when that LH surges and the follicle releases the egg, let's talk about the second half of the cycle. So in the second half of the cycle, when that follicle has released the egg, that follicle is going to become something called a corpus luteum. And this corpus luteum is what's going to help bring out progesterone or help build progesterone to help thicken the lining, and then also help with implantation if someone's trying to conceive. So when we talk about the second half of the cycle, typically it should be around 14 days. It can range between 10 to 14, but typically you want it to be around that 14-day period. If it's shorter, or if you're experiencing spotting, this can be signs of low progesterone, which is also very common in PCOS. So when you're doing an ovulation test, you're testing for LH. So this is that hormone I was telling you about, only spikes around ovulation. Sometimes it can ride high throughout the whole cycle in women with PCOS. So how do we figure out if you're actually ovulating, which is often the question that gets asked for PCOS women, especially if they're trying to conceive. First things first is you can try LH strips. These strips sometimes work for some women with PCOS, but it's not foolproof. It doesn't work all the time, especially if the LH is always coming back positive. In some women with PCOS, we actually do see it's perfectly normal. We do get that LH surge. It just might not be at the appropriate time, or it might. I mean, I guess even if it isn't appropriate, you can still get pregnant on LH surge on cycle day 20, 30, whatever it is. It just, the quality of the egg might not be as best if we have that later ovulation. So the ability to actually get pregnant might be a little bit reduced. In any case, LH strips are great to try. The other option is basal body temperature, but this tells you if you've already ovulated, because once that follicle releases the egg, the corpus luteum is going to make progesterone, and progesterone is our heat hormone. So our temperature rises, and when that happens, that's when our basal body temperature is going to go up, and it's going to tell us that we've already ovulated. So really, that one can be really tricky with women with PCOS. So I would, start with LH strips and see if it works for you or not. Other options are things like Mira is a fertility device that actually you pee on a stick, and instead of just looking at lines, you actually insert it into their device and it gives you a reading. Another one is OvuSense. So this one's predicting ovulation based on a slight rise in progesterone right before ovulation happens. So that one's interesting as well. So these are some devices that you can take a look at to figure out if ovulation is happening. The next thing is, after ovulation has occurred, checking to see what the progesterone and estrogen look like in lab work, so on our blood tests. Typically, we want to measure this around 7 days after ovulation, so 7 days after that LH has surged. And this is because if we have a 14-day luteal phase, so the second half of the cycle is called the luteal phase, we want to be testing around that 7-day mark after that, so that we get the middle of the hump, I guess, the curve. So if we have a 14-day luteal phase, we want to be testing 7 days after ovulation to get into the peak of estrogen and progesterone. Oftentimes what I see is everybody's being tested for estrogen and progesterone and for ovulation on cycle day 21 in fertility clinics. And if your progesterone is really low, then that means that it looks like you could be not ovulating. But it is untrue for women with PCOS, because not everybody with PCOS is going to have this 28-day perfect cycle where they're ovulating on cycle day 14. We test 7 days after on cycle day 21, and we see the progesterone is high enough. So what I would suggest is actually waiting until ovulation happens and then testing after that. Because if you ovulate on cycle day 20, 21, 22, even on, let's say, cycle day 20, you want to be testing your estrogen and progesterone on cycle day 27. So if you were to test it on 21, it's going to look like you haven't ovulated yet because you haven't. So really, lab work is important when it comes to ovulation, but looking to see when it's happening and getting the blood test at the right time is very important. So this is all about how ovulation works and a little bit about lab work. And, I'm going to talk a little bit about the causes of late ovulation. And then next week we'll talk more, excuse me, about some of the things that you can do for ovulation, especially in PCOS. So, you know, when it comes to ovulation and PCOS, the issue is this high testosterone. So if we can bring the testosterone down and allow for estrogen to rise, this is going to help with ovulation. Some of the issues and the reason why testosterone is high can come down to the fact that insulin resistance is present, and that's actually causing higher levels of testosterone. So working on the insulin resistance piece is actually really, really important when it comes to PCOS, and we'll talk more about that next week. If you're interested, I have this PCOS food cheat sheet that can help with insulin resistance. So I can drop the link in the comments below, and you can take a look at that if you'd like. Basically, bringing down that testosterone and figuring out if insulin resistance is present is number one. And then, figuring out how to treat that. So next week, I'm going to jump on here and talk all about how can we fix ovulation in women with PCOS and some of the things that we can do for it. So stay tuned for that. Hope you're having a wonderful day, and I'll see you next week. Take care, guys.